Sure. When we're looking at the use of sodium oxybate, one of the biggest challenges that we've experienced is that in some patients you can see this either new development or worsening of sleep disorder breathing. When we see the sleep disorder breathing, the one that is most problematic is central sleep apnea. In the case that I've illustrated, you see a young girl who was put on sodium oxybate. She had transformational experience for the treatment of her narcolepsy with that. Unfortunately, the mother had noticed that there was episodes of apnea. When we studied her, we saw that her AHI, or apnea-hypopnea index, was over 100, which is clearly an extraordinarily alarming finding. When we looked at this, and I had discussed with the family the potential of removing sodium oxybate as the treatment and trialing other therapies, they were completely against it. And so that then made me have to think of what else can we do. As a neurologist, I commonly use Topiramate in a variety of conditions, including migraine, epilepsy, as well as idiopathic intracranial hypertension. And part of the reason we use it there is for carbonic anhydrase inhibitor use. We also use carbonic anhydrase inhibitors in central sleep apnea for other disorders. So this was a young woman who also had migraine, and so it suited her to be able to trial this. When we used it, what we identified is that her AHI went from over 100 down to less than 5, and therefore was allowing her to continue forward on this treatment. This case study really illustrates a potential opportunity for treatment considerations when you have a person who may be experiencing side effects that are not demonstrating a lack of tolerability.